Hey everyone, welcome back to the channel. Today, we're tackling a topic that's often surrounded by silence and stigma: erectile dysfunction, or ED for short. ED is more common than you might think, and it can have a real impact on a man's confidence in relationships. The good news is, ED is often treatable once you understand the root cause. We're going to break down the science behind ED, exploring the various factors that can contribute to it. Over the next few minutes, we'll cover everything from physical conditions like heart disease and diabetes to psychological factors like stress and anxiety. So, let's get right into it. Alright, let's jump right in and talk about the physical factors that can contribute to ED. First up, we have cardiovascular disease. Erections happen when blood vessels in the penis relax and allow for increased blood flow. But when those blood vessels are damaged or narrowed due to conditions like high blood pressure, high cholesterol, or atherosclerosis, it can restrict blood flow and make it difficult to achieve or maintain an erection. Think of it like this. If you have a kink in a garden hose, it's going to be tough to get a strong flow of water to your plants. Similarly, any blockage or damage to the blood vessels in the penis can hinder blood flow and lead to ED. Next, we have diabetes, which is another major risk factor for ED. Over time, high blood sugar levels can damage nerves and blood vessels throughout the body, including those in the penis. This nerve damage, known as neuropathy, can interfere with the signals between the brain and the penis that are necessary for an erection. Hormonal imbalances can also play a role in ED. Testosterone, the primary male sex hormone, is crucial for a healthy libido and erectile function. When testosterone levels dip below a certain threshold, it can lead to a decreased sex drive and difficulty achieving erections. This can happen naturally with age, but certain medical conditions, medications, and lifestyle factors can also contribute to low testosterone. Now, let's talk about obesity. Carrying excess weight, especially around the abdomen, can increase your risk of developing ED. This is because obesity is often linked to other conditions like heart disease, diabetes, and low testosterone, all of which we've already established can contribute to ED. Moving on to neurological disorders. Conditions that affect the nervous system, such as Parkinson's disease, multiple sclerosis, and stroke, can disrupt the nerve signals necessary for an erection. These conditions can damage the nerves that control erections or interfere with the brain's ability to send signals to the penis. Peyronie's disease is another condition that can cause ED. It involves the development of scar tissue or plaque inside the penis, which can cause curvature, pain, and difficulty achieving or maintaining an erection. Finally, certain medications can also contribute to ED as a side effect. Now let's shift gears and talk about the psychological factors that can contribute to ED. Because believe it or not, what's going on in your head can have a big impact on what's going on, well, first and foremost, stress is a major culprit. When you're constantly stressed, your body goes into fight or flight mode. This means your body is prioritizing survival over other functions, including sexual arousal. Think about it. Your body isn't too concerned about getting frisky when it thinks it's in danger. Chronic stress can also lead to elevated levels of the hormone cortisol, which can interfere with testosterone production and contribute to ED. So finding healthy ways to manage stress, such as exercise, meditation, or spending time in nature, is crucial for both your overall well-being and your sexual health. Next up, we have anxiety. Just like stress, anxiety can trigger that fight or flight response and make it difficult to relax and get in the mood. Anxiety related to sexual performance can be particularly problematic. If a man has experienced ED in the past, he might start to worry about it happening again, leading to a vicious cycle of anxiety and erectile difficulties. This is known as performance anxiety, and it can be a real confidence killer. Depression is another mental health condition that can have a significant impact on sexual function. Depression can sap your energy, decrease your libido, and make it challenging to experience pleasure, all of which can contribute to ED. Additionally, some antidepressants used to treat depression can have sexual side effects, including ED. Relationship problems can also take a toll on a man's sexual health. Issues like communication breakdowns, unresolved conflicts, and a lack of intimacy can create emotional distance and make it difficult for partners to connect both emotionally and physically. Chapter 3. Let's talk about lifestyle factors that can impact erectile function. Now, you know I'm all about healthy habits, and that's because they play a huge role in your overall health, including your sexual health. First up, smoking. We all know smoking is bad for us, but did you know it's also a major risk factor for ED? Smoking damages blood vessels throughout the body, including those in the penis, restricting blood flow and making it tougher to achieve and maintain erections. So if you're a smoker, quitting is one of the best things you can do for your health, both in and out of the bedroom. Next, let's talk about alcohol. While a glass of wine with dinner might not hurt, excessive alcohol consumption can actually contribute to ED. Alcohol can interfere with the nerve signals involved in achieving an erection and can also lower testosterone levels over time. So moderation is key when it comes to alcohol and sexual health. Drug use is another major no-no when it comes to ED. Many recreational drugs, including marijuana, cocaine, and amphetamines, can interfere with blood flow, hormone production, and nerve function, all of which can contribute to erectile difficulties. So steering clear of recreational drugs is essential for maintaining healthy sexual function. Now let's get moving. Lack of physical activity can also contribute to ED. Regular exercise is crucial for maintaining good cardiovascular health, which, as we discussed earlier, is essential for healthy erections. Exercise helps improve blood flow, boost testosterone levels, and reduce stress, all of which can benefit your sexual health. Last but not least, let's talk about diet. Chapter 4. Now, let's talk about age and its impact on erectile function. It's a natural part of life, guys. And as we get older, our bodies change, and that includes our sexual function. It's important to understand that ED is not an inevitable consequence of aging. However, as men age, they may experience certain changes that can increase their risk of developing ED. One of the main factors is a gradual decline in testosterone levels, which typically starts around the age of 30 and continues throughout life. Testosterone is crucial for libido and erectile function, so as levels decline, men may notice a decrease in sexual desire and more difficulty achieving erections. In addition to hormonal changes, age-related health conditions can also contribute to ED. As we discussed earlier, conditions like heart disease, diabetes, and high blood pressure become more common with age and can significantly impact erectile function. Furthermore, certain medications that are commonly prescribed to older men, such as blood pressure medications and antidepressants, can also have side effects that contribute to ED. It's important for men to discuss any potential side effects of their medications with their doctor, as there may be alternative treatments available that are less likely to impact sexual function. Now, while some degree of age-related decline in sexual function is normal, it's essential to remember that it doesn't have to mean the end of your sex life. There are many things men can do to maintain their sexual health as they age, including 1. Staying physically active. Regular exercise can help improve blood flow, boost testosterone levels, and reduce the risk of developing health conditions that can contribute to ED. 2. Eating a healthy diet. A balanced diet rich in fruits, vegetables, and whole grains can help maintain overall health and reduce the risk of developing conditions that can impact sexual function. 3. Managing stress. Chronic stress can wreak havoc on both your physical and mental health, including your sexual health. Finding healthy ways to manage stress, such as exercise, meditation, or spending time in nature, is crucial. 4. Communicating with your partner. Open and honest communication with your partner about any concerns or changes you're experiencing can help strengthen your emotional connection and improve your sex life. And 5. Talking to your doctor. If you're experiencing ED, don't suffer in silence. That was a lot of information, but I hope you found it helpful. Remember, knowledge is power, and understanding the potential causes of ED is the first step towards addressing it. If you're struggling with ED, please know that you're not alone. It's a common condition and there's no shame in seeking help. So stay informed, stay proactive, and take charge of your health.